from the beginning, if you invest in a basket of some of the companies, investments participating in, some of the biggest trends in technology or some of the most promising technologies, that you're going to have market-beating performance. And
What do you mean by a basket?
well, you want to spread your bets around because not every good idea works. Or it's a good idea, but there's competition that emerges. In biotechnology, not every plausible theory of how to heal a disease survives, the cold hard truth of reality in clinical trials. A lot of drugs never make it. So there's stuff like that. But if you spread your bets around a bit, the winners will by far eclipse your losers, and you're going to end up ahead of the game. And that's been what we've seen for many years now.
And so this is a part, because I want to dig into some of the things you are betting on or think people should bet on right now. But the strategy is basically take almost like maybe a sector or subsector and saying, hey, there's 3 or 4 or 5 or 7 players in it, and really kind of spread bets around all of them as compared to picking one.
Right.
Can you give like an example of that? That might be current.
Sure. So biotechnology is a good example. You don't want to put all your money in one early stage company working on cancer or Alzheimer's disease. You want to look at, and you got to get them at the right time too. You want to look at a number of them and invest in a number of them. Maybe half of them might not result in what you wanted, but the other ones, especially if they're at the proper stage of development, they're not a huge pharmaceutical company. They're a small cap, and they're still not on the market with any products. Maybe half of them will make it in their late stage, phase 3, and they'll have good results. And you'll end up triple, quadruple digit gains on those kinds of companies. And the ones that were failures, you're offset there.
Right. And when you're talking about late stage, you're talking about where they are in FDA as far as the trials and
the
how
clinical
they're
trial
along.
process.
And so you're kind of tracking this whole process as it moves along.
Right.
Now, this is interesting because if you look at the whole area of cell therapy and stem cells and other types of cell therapies, it's kind of the wild, wild west right now. So have you been analyzing this and have you been giving some opinions on this?
Yeah. So there's a lot of stuff that gets touted that, in my opinion, after following the space for many years, it's probably never going to yield any benefit. But that doesn't preclude stem cell therapies themselves from, having a lot of therapeutic promise. So, there's companies out there that do have platforms that show a lot of promise. We've already seen some cell-based therapies. They're not stem cells, but in 2017, the FDA approved 2 cell-based therapies for treating cancer. They're some of the first that we've ever had. We've got emerging cell therapies to for regenerative medicine to rebuild tissues that are damaged by disease or aging or things of that nature. So, there's a lot of promise in that area. It's been a long time coming, but I think it's finally starting to mature, that we're starting to get some results in terms of these therapies getting into the market.
Well, what's interesting is a lot of these therapies are in the market, and there's companies that are blossoming and growing out of it, and they're being applied every single day, but there's not necessarily FDA clearance for doing it. How do you think this is all going to shake out?
Well, the U.S. has been difficult for these kinds of therapies. The FDA wants something that you can replicate very deterministically. The problem with cell therapies, there's a lot of variance from person to person. Everybody's genome is different. How if you give somebody stem cells for rebuilding their cardiovascular system, how those cells multiply, divide, and do their thing is very variable. So we need different metrics. The way the FDA has analyzed new therapies in the past, it's kind of a one size fits all, sort of a Model T forward medicine approach where you have large numbers of people, but as we've learned more about the human genome and epigenetics, and we're all snowflakes in a way, right?
Right.
We need to be able to have a regulatory framework that can allow these more tailored sort of therapies to emerge. But the U.S. isn't the whole world. There's other parts of the world that have their own regulatory frameworks. Japan has been a lot more flexible in this. Now, the FDA is moving in the right direction under its new director, Scott Gottlieb. It's been doing that under his predecessors as well. We're seeing an FDA that's working a lot more with developers with these kinds of new therapies and making it easier for them to bring them to market, make a lot of money, but also help people in need.
So right now, have you been recommending certain stocks or certain companies saying, hey, we think they're on the right path?
Yes.
Relative. So can you talk about those or what you've been writing about?
Oh, well, there's one company I like a lot. It's based in Alameda, California, Biotime. The man that founded the company, he basically, Dr. Michael West, you could say he's the father of regenerative medicine. He wrote the book on stem cells. He spent many years, he's accumulated a lot of intellectual property. He's figured out one of the difficulties of stem cells is how do you manufacture them. And with high quality consistency, the cell culture that you're going to give this person is precise. Those cells are going to differentiate into the right types of adult cells and not into the wrong type. That's a big deal. So he's built this whole cell manufacturing platform. He spun out the technology out of Biotime. We just had an IPO a few months ago using Biotime's technology. The name of the company is Ajax Therapeutics. Dr. West is heading that company now, along with world-famous anti-aging researcher Aubrey de Grey. He's got a big role there, and they've made some discoveries. They ran using basically supercomputers. They ran an analysis of all the changes in a genome as it passes through the embryonic through to the fetal stage, everything that changes, and they found this one switch, which is pretty amazing. It's just mind-blowing.